ACP's role as a company is basically to provide the rehabilitation technology, the specialized treatment programs, and the advanced therapist training that therapists need to really be able to treat a broader range of conditions and more medically complex conditions. The latest example of our technology is the OmniVR. And what the OmniVR does for therapists is really to provide them with a tool that gets patients more excited about the therapy process. And what they're finding is that basically patients, when they're immersed in more of a virtual reality sort of environment, they're more willing to exercise harder, they'll exercise longer, and they forget about the fears that they may have about their physical condition.
I use the OmniVR with folks who need to get moving or they're afraid to move. A lot of folks who it's just they're absolutely terrified to get out of their chair, or when they're standing up they're looking down and they won't keep their eyes off their feet. It helps them to look up. It helps them to realize a goal different than just you want me to walk. It's they have a vested interest in the game, and it takes their mind off of what I have to do, or I'm not good enough at this, or what have you, and it gets them moving. And it's those folks who especially were really anxious or didn't really like therapy, or they kind of groan when they see you walk in the room. These folks are the ones that are kind of, oh, that was fun, or is our time up already?
So Dorothy is a patient here, and she is really reluctant to do things that she thinks are going to be challenging. So if you want her to step to the side or step backwards, she'll say, I can't do that.
Here you go.
But when she's using the OmniVR and playing the fox game or the mole game, she's stepping all over the place. She's stepping side to side, backwards, and she's not thinking anything of it. So she really loses a lot of the fear that she has when you ask her to do those tasks separated out from functional activities or from playing the OmniVR.
See if you can just step over with your right foot like we practiced. Good. And then the left foot. Good. Good job. Whoops, try to step back a little bit. Think you're going off the screen. And then try to step over. Nice job. So you got 11 moles. Not too shabby, huh?
I think the thing that makes it a skilled therapy tool is that there's various parameters, and you have to really take your patient, have them try it, and then adjust the parameters to fit their needs specifically. Specifically from an OT standpoint, I know that I choose games based on what their deficits are. So if they're having trouble moving side to side, I'm going to pick a task or a parameter that's going to really focus on that movement. Or if they're neglecting part of their body, I'm going to take a parameter and make it so the game is specifically focusing on the side that they're neglecting. And whereas a game like the Wii, a lot of my patients can't do it because it's not, you can't specify it to your patient well enough.
One thing I really like about the OmniVR is the amount of specific parameters that it has, and which gives the therapist a lot of different ways of making it specific to that patient. And it's pretty easy. I'm in the mole game, and instead of just choosing one of the preset choices, I'm actually going to come down to parameters, and if I have someone that's working on gait and balance, I like the mole game. But if they're a little bit more advanced and I want them to do more, to do quicker transitions from forward to backward or sideways, then I'll change it from mole to mouse. Instead of choosing the moderate difficulty, which also has the ladybug, which is something you have to avoid, I just want them to walk faster and make their transitions a little bit speedier. And so easy, and then I can go back to the main screen and have them start the game.
I use the OmniVR to get better. My left side is, I had a stroke and it affected my left side, And so I'm doing all these exercises and things like that to improve my balance and so on.
How does it feel when you play the games on the Omni?
Oh, this is kind of fun, you know. I'm glad that I got a few.
Now you've been doing physical rehabilitation, physical therapy for a few weeks now, or?
No, just a few days.
A few days, okay. So how has it been? How has it felt every time you play the games?
Oh, well, it feels like I can do a little bit more each time, every time I play the games.
How does this compare to the other games or the other rehabilitation exercises you do here?
Well, I think this kind of exercise is more fun, and it's easier to do, and you get a good feeling when you beat the whatever is there to be beaten.
The patients usually tell me about the OmniVR that first they can't believe that this is rehab. What I find exciting about it is the camaraderie that they have if they're having a group session. It's great to see that athleticism, I think, from an 80-year-old and that competitive nature. And the encouragement that they give each other if someone's really struggling. They really are there like a team to encourage each other, and it's fantastic, and you're not going to see that if you're doing leg lifts.
Well, I think that machine is very interesting. Every time I take it, everything I do with it, it's very interesting, and I think it does help a great deal in learning, you know, to be faster and learning how to go from side to side quicker, and well, in every way, I think it does help.
Well, I find myself doing things that I didn't think I could do, and so I'm happy that, yeah.